The next talk is going to be by Professor Mahipal Sachdev, who is the Chairman and Medical Director, Center for Side Group of Hospitals, New Delhi, and he is going to be talking about innovations on Smile.
Thank you very much, Namrata. And after a fantastic presentation by Dr. Tetial, I'll be talking about innovations in Smile. So this basically, there have been innovations in Smile, which I'll be referring to. The first part has been covered to a large extent by Dr. Tetial, which is something that is very, very important for a person to learn. Addressing astigmatism is the second thing. Some complications I'll be talking about, the innovative use of circle software and the innovative use of lenticule. So this is how I'm going to divide the talk. So this is the meniscus sign, which has obviously been described by Dr. Titial, and this is something very, very important. The white ring sign is the next sign that has been described by Dr. Susan. You can see that this is a white ring, which is seen in this particular case, by which you can make out whether you're hitting the edge or not. This is something that has been described by Dr. Gitansha, Dr. Ramamurthy, and this is known as the stop sign. So I'll just show the stop sign. So what is actually what Dr. Titial said, like you go on to one side, in this case, it is the upper going on to the right and the lower going on to the left. But if you try to move this, you can see that there is a stoppage of the movement. So what it shows clearly is that there are two separate planes that you are working on. Otherwise, you won't get this resistance. So if you look at in this particular case, there is no stop sign which is there. So that means that you are only in one plane. Which is obviously going to have the problem. So you can see here that this is the first plane. And then as you go in again, and which you are thinking that you are now posterior, you go to the left, that's fine. But when you go on to the right, you see that it has broken easily. So this is an absence of stop signs. So there'll be a problem later because you are only in one plane and you have to go and dissect that. Now, lack of cyclotorsion is something which is there or was there in a system that is there. So what can be done is that you do mark with a pen which does not allow, which allows the infrared laser to go through, and you can see this is the mark and you can align it to the lenticule. But now with the new systems that are available, whether it is the Smile new system that is there, or whether it is the new Zimmer or the new Elita, that is the J&J that is there. So there is a cyclotorsion compensation that has come in. So that is something important in the innovations that have come in the lenticule extraction. Now, when you're looking at complications, again, Dr. Tetial has reported this, the use of the OCT. So you can see that this is an edge of a lenticule, which is there, as you can see here. So this is an edge of the lenticule. Again, this is a folded lenticule. So an OCT can give you a fantastic outcome as regards seeing what it is. This can also be used as an intra-op OCT, as you can see in this particular case. So this is the lenticule as we are going. So again, if you look at it, this is the entry. This is the second part. So I'll just show you. So once the edges have been created at the 2 points, you can see that this, can you see this? So this is going into the posterior plane. So this is easily shown that this is going into the posterior plane. So you are in the wrong plane that is there. So one has to actually go back in and try to dissect. And again, you can see now we have entered the anterior plane. And I'll just show you that when you go in, now you can see easily this is the anterior. So one was this is the anterior and the earlier was the posterior. So the OCT use has been documented, and it is a good thing to actually go and see the cleavage plane. Now, this has again been described by Gitansha and Shreyas and Dr. Ramamurthy, and this is the use of triamcinolone. So if you have a retained lenticule, as is shown here, you can use actually triamcinolone to actually see as to where exactly is the retained lenticule part that is there. Now, this is the circle software which we have the use. There are two uses that we are going to talk about. So this is the circle software. In this particular case, you can see that the side cut is not there. So you can see that the side cut, we lost the suction at this particular point, but since we had completed, so there is no way. So I am trying with a blade, doesn't happen. So what we are doing in this particular case is the use of a circle software. So you could see that this was the previous cut, but because of the OBL, it had gone. So what is being done is that this is now being, you are separating it out. and you have created a flap, and you can take out the lenticule and use the circle software in such a challenging situation. In this particular case, there is a time and again there is loss in a flap that is being created. So you can see this is again running through, and again the side cut of the flap doesn't come, and there is again a problem that is there to get into the side cut of a flap. So you can use the circle software with only the side cut. So see here that this is only, this is only the side cut that is being created with the circle software, and this is only the side cut that has been created, and you can go ahead and lift the flap. We have described the use of tailored stromal expansion with refractive lenticule for cross-linking of ultra-thin corneas. This was described way back in 2015, wherein we are taking a lenticule of the cornea and putting it onto the thin cornea. We are taking the lenticule from a donor, and we can see as to how much we want. We want 60 microns, 100 microns. So depending upon the refractive correction that we are doing in a patient, remove the epithelium. This is just the lenticule being taken out. And once the lenticule is taken out, you can actually put this lenticule, take the lenticule, it sits over the cornea. There is no warpage like in a contact lens, and it's not a fixed thickness that we have. And it is the same tissue that you are using. So the radiation would go in exactly as it would for the rest, and once the rest of the cornea. And once you have done the cross-linking, you can remove it. This has also been published in the American Journal of Ophthalmology, where we have said that this works, the lenticule, even with the intracorneal ring segments and thin corneas, and we have reported our results there. Now, when you look at further innovations of the lenticule, Philly has been described by Dr. Shri Ganesh, and that is the lenticule being used only in spherical cases for hyperopic correction, and you put this and you can get hyperopic correction. Shri Ganesh has also described the use of the lenticule for keratoconus. So you can put it and you can have a flattening of the cone, and that's what Dr. Shri Ganesh has described for the use of a lenticule. A smaller part of the lenticule has been described by Susan for correction of presbyopia. So these are a couple of innovations that have been described in the technique of SMILE. Suffice to say that there are, as things stand today, I think 3 commercially available systems apart from the Zeiss. You have the Zimmer Z8, and I think the Schwind is also commercially available. And within 1 or 2 quarters, I hope that the J&J system would also be there in the market, having gone on to the phase 3 studies of that system. So almost everyone, I don't know whether Alcon is also moving or not, but almost all the companies are moving towards the lenticular extraction, because that is least invasive, less dry eye, no flap related complications, and better biomechanical stability. And in thin corneas, you can also do SMILE extra for getting better biomechanical stability. So I would say that technology would change, is changing, and the future of refractive surgery is becoming more precise. Hyperopic corrections also we are working on, and hopefully we wouldn't need anything like Philly to get the hyperopic corrections. Thank you very much for your kind attention.